How does lead placement affect DBS programming? Have you ever wondered how the placement of leads in the brain can impact the effectiveness of deep brain stimulation for Parkinson's disease? This is a fascinating topic that combines neuroscience with patient care. Deep brain stimulation, or DBS, is a surgical treatment where electrodes, known as leads, are implanted in specific areas of the brain. These leads deliver electrical stimulation to help manage symptoms of Parkinson's disease. The location of these leads is crucial. One of the most common targets for DBS in Parkinson's disease is the subthalamic nucleus. Research indicates that the exact position of the stimulating contact within this area can significantly affect how well symptoms improve. For instance, leads placed in the posterolateral portion of the subthalamic nucleus can lead to remarkable improvements in motor symptoms like tremors and rigidity. In fact, studies have shown that patients can experience up to a 71.5% improvement in motor function with this optimal placement. When it comes to programming the DBS device, the lead's location plays a vital role. Programming involves adjusting stimulation parameters such as amplitude, pulse width, and frequency to maximize symptom relief while minimizing side effects. If leads are positioned too medially or anteriorly, they may inadvertently stimulate adjacent brain structures. This can lead to unwanted side effects or reduced motor benefits, which means careful programming adjustments are necessary to find the right balance. In some cases, even with proper lead placement and programming, patients may still experience persistent symptoms. For these individuals, adding a second rescue lead that targets a different brain region can be beneficial. This approach allows for dual stimulation, which can help manage symptoms that are difficult to control with a single lead. The trajectory of the lead during implantation is also important. If the lead passes through certain brain areas, such as the head of the caudate nucleus, there may be an increased risk of cognitive decline after surgery. This highlights the need for precise surgical planning to avoid complications that could affect programming and overall patient outcomes. Practically speaking, preoperative imaging and intraoperative testing are essential for neurosurgeons to identify the best lead placement. Neurologists relying on patient feedback and symptom responses during surgery and follow-up visits to fine-tune DBS programming based on the lead's location. Understanding how lead placement affects stimulation settings is key to maximizing motor benefits while reducing side effects. In summary, the placement of leads in deep brain stimulation is a critical factor in the success of the treatment for Parkinson's disease. Accurate positioning within the target brain region can lead to significant improvements in motor symptoms and effective programming. On the other hand, suboptimal placement may require complex adjustments or additional interventions. This precise targeting is essential for tailoring therapy to meet individual patient needs and improve their quality of life. Always consult with healthcare professionals for personalized medical advice regarding DBS and Parkinson's disease.